The hidden dangers of penile inactivity: how to restore sexual health. Hi, I'm Dr. Emily Collins, a urologist, and today, I want to talk about something many men might not realize: neglecting sexual activity can have serious consequences. When the penis isn't used regularly, it can negatively impact sexual health, leading to both physical and emotional challenges, particularly for older men. Whether due to relationship struggles, grief, chronic illnesses, or everyday stress, penile inactivity can result in erectile dysfunction, tissue atrophy, and even fibrosis, all of which can significantly lower quality of life. The good news is that there are effective ways to restore and maintain a fulfilling sex life. In this video, we'll explore the causes of penile disuse and the practical steps you can take to prevent or reverse its effects. Before we continue, make sure to subscribe so you don't miss future videos on sexuality and relationships. If you find this information valuable, please like this video. It helps more people discover this important content. And don't forget to share it with friends or loved ones who might benefit from this discussion. Also, leave a comment below, type 1 if you find this topic relevant or 0 if it wasn't as useful. Your feedback helps us create even better content. Why does penile inactivity happen? Sometimes, men notice that their penis isn't as active as it once was. This can happen for various reasons, some related to physical health, while others are tied to emotions. Understanding these causes is the first step toward finding solutions and reclaiming a healthy sex life. Let's explore the most common reasons why penile inactivity occurs. 1. Relationship problems. When a couple faces conflicts, intimacy is often one of the first things to suffer. A lack of communication, frequent arguments, or emotional distance can reduce sexual desire. Sometimes, one partner may feel neglected or misunderstood, leading to physical withdrawal. Without a strong emotional connection, sexual intimacy naturally declines, making penile disuse more common. This emotional strain creates an invisible barrier, making it difficult to restore closeness. The more a couple drifts apart, the harder it becomes to rekindle intimacy. If this sounds familiar, taking steps to improve communication and rebuild emotional bonds is crucial. To support a more fulfilling sex life, I'm offering my ebook, Rediscovering Intimacy: Healthy Sexuality After 60. It provides practical and motivational guidance to strengthen relationships, overcome emotional and physical challenges, and reignite passion. Get your copy by clicking the first pinned comment, but don't wait. Copies are limited, so take this opportunity to transform your love life. 2. Grief and emotional loss. Losing a loved one is one of life's most painful experiences, and it can deeply affect sexuality. Grief can make a person feel lost, disconnected, and uninterested in activities they once enjoyed, including sex. During mourning, intimate desires often fade because the emotional and physical connection feels different or even impossible. This disconnection can last for months or even years, making it difficult to return to intimacy. The longer grief suppresses sexual desire, the more the body adjusts to life without it. Additionally, many men fear opening their hearts to new relationships, further prolonging sexual inactivity. While grief is natural, understanding its impact on sexual health is essential to regaining intimacy when the time feels right. 3. Chronic illness. Serious health conditions like cancer, diabetes, or heart disease can significantly impact both the body and mind. Treatments such as chemotherapy or radiation can cause fatigue, pain, and hormonal changes that lower sexual desire. Additionally, the stress of managing a chronic illness can leave little energy for intimacy. Physical limitations may also hinder sexual activity, creating frustration and further distance from one's sex life. Over time, this disuse can make it difficult to return to sexual activity, even after recovery. However, with medical guidance and the right support, many men can regain intimacy despite health challenges. 4. Stress and work overload. When a man experiences chronic stress, whether from work, financial concerns, or personal challenges, his body naturally prioritizes survival over pleasure. The brain redirects energy toward handling these pressures, often suppressing sexual desire in the process. Over time, this lack of sexual activity can become routine, leading to a cycle of reduced libido and penile disuse. The longer this persists, the harder it becomes to reignite intimacy, making it crucial to recognize and address stress-related sexual health issues before they become ingrained habits. 5. Decrease in testosterone levels. Similarly, aging-related hormonal changes can contribute to declining sexual activity. Testosterone, the key hormone responsible for libido and erectile function, gradually decreases with age, especially during andropause. This natural shift can lead to lower energy levels, reduced sexual interest, and difficulty maintaining erections. While this decline is normal, it doesn't mean an active and satisfying sex life is out of reach. With the right medical guidance, lifestyle adjustments, and possible hormone therapy, men can maintain their sexual health well into later years. The consequences of penile inactivity. When the penis isn't used for extended periods, several health issues can arise. Let's take a look at the most common consequences. Decreased oxygen in penile tissues. Blood flow delivers oxygen to the penis, keeping tissues healthy. Without regular erections, circulation decreases, leading to internal changes. Over time, smooth muscle tissue may be replaced by collagen, reducing flexibility and making erections more difficult. Solution. A vacuum erection device can help increase blood flow and improve oxygenation. Penile fibrosis, a buildup of collagen can lead to abnormal hardening, making it difficult for the penis to expand properly. In severe cases, it can result in Peyronie's disease, causing painful curvature. Solution. Pelvic floor exercises and physiotherapy can improve circulation and maintain flexibility. Penile atrophy, reduced blood flow over time can cause the penis to shrink, making it less sensitive and harder to achieve an erection. Solution. Regular stimulation, vacuum therapy, and medications like tadalafil can help maintain penile health. Erectile dysfunction. Without regular use, the blood vessels in the penis weaken, making it harder to get or maintain an erection. Solution. Medications, healthy masturbation habits without excessive pornography, and physical therapy can help prevent long-term dysfunction. How to restore and maintain sexual health. Every man's body is unique, but maintaining sexual health requires action. Here are some key steps. Checkmark. Engage in regular physical activity to support circulation and overall health. Checkmark. Use vacuum erection devices to keep blood flowing and prevent tissue deterioration. Checkmark. Consult a urologist for medical guidance and potential treatments. Checkmark. Consider pelvic floor exercises to strengthen muscles and support erections. Checkmark. Address emotional health, stress management and open communication with your partner are essential. Final thoughts. I'd love to hear your thoughts on this topic. Have you or someone you know experienced the effects of sexual inactivity? Your insights could help others facing similar challenges, so feel free to share your experiences in the comments below. If this video was helpful, please like, share, and subscribe. Your support helps us reach more people who need this information. Don't forget to turn on notifications so you never miss our upcoming discussions on sexual health, relationships, and overall well-being. Thank you for watching, and I'll see you next time.